I'm Dr. Jonathan Steinberger. I'm an interventional radiologist and co-founder of DOCS Interventional Medicine.
Hi, I'm Gabriel Lipshutz. I'm a physician at DOCS Interventional.
So a lot of people wonder what an interventional radiologist does. They think that maybe we just operate the x-rays for the surgeons to do the procedures. We're actually people who do procedures. We're kind of like surgeons, but we use very minimally invasive techniques. So instead of a big incision to do a surgery, we use tiny little needle punctures to treat conditions. So we're kind of like MacGyvers of medicine. We're problem solvers, but we use a very specific set of techniques to solve those problems. Instead of having to be on medications that can have a lot of side effects, people have to remember to take lots of pills, they can make them feel crummy, can have a lot of side effects or complications, or having to undergo invasive surgeries with prolonged, difficult recoveries and a lot of risk. We use our techniques to treat those same conditions and get very comparable results, but it tends to be a lot easier for patients to undergo our procedures than any of those other approaches. And so that's what excites us about what we do.
So why do you think anybody should come see an interventional radiologist in general?
I think a lot of patients, when they're given a diagnosis or a condition, it can be very overwhelming and they're dealing with a lot of new information coming their way. But really what they need is options for different approaches to take care of that problem. And different practitioners they may encounter might tell them about different procedures or treatments or medications they can take, but they may not get the full spectrum of all of their options. We offer a particular set of solutions that are less well known, but a lot of times highly preferred. And we're not looking to necessarily say we're the only solution for their problem, but if it was my family member, I would want them to know that that was an option for them. And we want to be part of a team of doctors taking care of them.
So do you think that, like for example, somebody with an enlarged prostate, should they come straight to an interventional radiologist for prostate artery embolization, or should they go to the urologist too?
I think patients who have enlarged prostates should definitely see a urologist so that they're clued into all of the aspects of urologic care that are so important. But I think they should also see an interventional radiologist because they should know about our techniques. What do men experience when they have an enlarged prostate? What's that like for them?
So, an enlarged prostate usually results in what we call lower urinary tract symptoms. So that's urinary hesitancy, intermittency, stopping and starting while you're peeing, urgency, having to run to the bathroom, feeling like you can't hold it, nocturia, peeing a lot at night, slow stream and dribbling. Those are all signs of benign prostatic hyperplasia, which is basically an enlarged and stiff prostate. So who do you think the best candidates are for prostate artery embolization?
The best candidates for prostate artery embolization would be people who don't want to be living on medications that have a lot of side effects, can affect their blood pressure, can affect their dry mouth, can have other side effects that just make them feel crummy. It can be patients who don't want surgical procedures where they're going in through the urethra, through the penis, and doing things where they're cutting and causing potentially risk of damage to structures or bleeding. I think all those people are good candidates for this procedure. I think also patients who just want to try an approach that is as minimally disruptive to them, I think are great candidates for this procedure because they come in, it's outpatient, they don't get a urinary catheter for the procedure, and we don't take any other treatments or approaches to this problem off the table.
Yeah.
They can still get the more invasive surgical procedures if they want, or if they need it.
So what does a genicular artery embolization look like? Like, how do you do it? What's the recovery like?
Patients come into our procedure center. They're given a little medication to relax them, but it's not a painful procedure. We give a little bit of local anesthesia. We typically go in either through the top of the thigh or the foot. We place a tiny little needle and access sheath, which is like a little, almost like an IV, into their vessels. We snake catheters in, we find the vessels that are causing the issue and we treat them. We inject little particles that reduce the inflammation in the joint. Everything comes out. They go into our recovery area for between an hour and 2 hours, and they're home that same day. And they might experience a few days of increased inflammation, increased symptoms in their knee, but within a week, that's gone. And within a couple weeks, their symptoms improve quite a lot.